guys, in this video I'm going to look at whether or not you need a scan when you've got Achilles tendinopathy. I'm going to look at how we diagnose Achilles tendinopathy, then I'm going to look at what scans may be useful. We're going to look at what scans can tell you and also what scans can't tell you. So my name is Marika. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want to have a link to our website. Good, so how do we diagnose Achilles tendinopathy? It's mostly done through carefully listening to what a patient tells you, because the symptoms of when they have pain, where they have pain, all of that tells you whether it's a tendinopathy or not. And then there's some clinical tests you can do. So interestingly enough, there was a group of researchers, I think it was 2013, where they looked at 10 of the different clinical tests that clinicians use in practice. And they wanted to see which ones were the most accurate. And they found that the two simplest ones gave the best results, which one is if the patient comes in and tells you, points to the mid portion of the tendon, this is where I get my pain. And the second was if you palpated the tendon, you could feel like that what felt like a swollen lump in it. So you didn't need any fancy tests or anything. All you needed to know was the patient to tell you where they feel the pain, and if it correlated with a tendon, that was pretty accurate, combined with feeling that lump or swollen area in the tendon. But that said, scans can be useful sometimes. Now, what scans can be useful? X-ray is a waste of time and money. I don't know why people are sending patients for X-rays for Achilles tendinopathy. They do it sometimes to see if there's heel spurs. Now, a heel spur is a little bony growth on the back of a heel. To be honest, there are loads of people walking around with heel spurs and absolutely no problems with their tendons. And long after you're better from your Achilles tendinopathy, you'll still have your heel spur. So heel spurs, in my opinion, is really a useless thing to look for, and you shouldn't get stuck on it. So stay away from X-rays. It can't show you anything about the tendons. It only tells you about bones. Ultrasound scans are extremely useful. They can show you the tendon structure. They can show you the thickness of the tendon. If there's areas in the tendon that's been injured, it can show you with the blood flow through the tendon, which is significant because when you've got a tendinopathy, you may see little extra blood vessels that's grown into the tendon, and they think that may be linked to why you get the pain as well. So yes, ultrasound scans, extremely useful for tendinopathies. MRI scans, just as useful for tendinopathies. Only difference is you can't see the blood flow through the tendons. But when they looked at whether ultrasound scans or MRI scans are better for diagnosing, to be honest, they're very similar. Both of them can give you false positives, which means that it can show that there's pathology in the tendon when actually there isn't. Although I would actually want to challenge that, because we know you can get a tendinopathy that doesn't give you symptoms. So I'm not entirely sure we would be saying that that's a false positive. They can give you false negatives though, that they don't show up tendon pathology, and then if you scan it in a slightly different way or something, then actually there is tendon pathology. So no test is ever 100% accurate, but the ultrasound and the MRI scans can show you really the best things we've got so far. Interestingly, with the ultrasound scans as well, some of the scanners can actually show you, they can measure tendon stiffness. So what we know is when you've got a tendinopathy, the tendon stiffness decreases. We're not quite sure yet how to use that in clinic, what it means when we measure that, but we're hoping that one day it can show us how much a tendon has recovered, but we haven't got enough data for that yet. So what can scans show us? Why would we want to go for scans? One, it can definitely confirm the diagnosis. It can show you the tendon pathology and everything in there, and it can be really useful for patients where the tendon's just not getting better. I always send patients for a scan if we've done 12 weeks of rehab and they're just not progressing, or they, even within the first few weeks, it's just not doing what I'm expecting it to do, because there are other things that can pretend to be a tendinopathy. So, for instance, your plantaris tendon, and some people can rub against the tendon, against the Achilles tendon. You can have tears in your Achilles tendon or the fascia next to it that can feel very similar to a tendinopathy. So it can be useful to rule those things out if the person isn't getting better. What it can't tell you is how severe your injury is or how long it will take for you to recover. We don't have predictive values yet like those. It can show you there's tendon pathology, but it can't tell you whether you're going to get better or not, or whether you're going to need surgery or not. We're just not that good yet, and we haven't. It all depends on rehab, to be honest, what you do with the tendon afterwards. Excellent. So let me know if you've got any questions, and if you need more help with your Achilles injury, you're always welcome to consult us via video call. The link to our website is in the description of this video. Take care.